Thank you. Well, good afternoon. I'm the Member of Parliament for the City of Durham, and as Peter said, Vice Chair of the All-Party Parliamentary Group. And it's such a pleasure to be here today. I'd like to thank Fresh for inviting me and for all the fantastic work that they've been doing in the North East, as well as support for my parliamentary work on this issue. And it's really nice to see so many faces here that I've known from the past years. It's lovely, really good, even though it's been maybe nearly 4 years, but you're still here fighting passionately to make smoking history. So as a councillor in Gateshead, I held the portfolio for health and wellbeing for nearly a decade. It was 2009 to 2019. And that included for me being the chair of the Tobacco Control Alliance in Gateshead. And we worked together with the voluntary and community sector, the local authority, the NHS and Fresh to tackle tobacco harm. And I saw firsthand really just how much you can achieve if you take a comprehensive approach to drive change through a multitude of initiatives. We funded education workers in schools, community-driven activities. One of the projects that some of you might have be familiar with was the project in Reckington in Gateshead in 2011, which was tackling health inequalities. And that project culminated in a lantern parade throughout the streets to mark No Smoking Day. But whilst it was a fun and very popular event, and it promoted smoke-free and second-hand smoke messages, it was crucial that we worked alongside the residents to encourage them to try and quit smoking, but also to support them with other aspects of the health as well. And these campaigns succeeded. In Reckington, after that, there was an increase of 347% in the number of local residents signed up to the Quit Stop Smoking services, which is brilliant. But these figures really reflected all of the hard work of those involved. And that success relied on funding, resources, and really in the political will to do something. And unfortunately, over the years, the reduction in budgets meant that we were limited in our ability to drive that vital change that was necessary. And that left our communities without that same level of support. So whilst there was an awful lot achieved there and smoking rates were reduced, we needed to keep our foot on the pedal to reduce people further from smoking, but from reducing the number of people who started smoking in the first place. And I think we really are very fortunate here in the North East to have such a highly effective regional tobacco control programme. But while regional activity, like the work of Fresh, is vital, so is strong leadership and investment from the government on a national level. And as I walk through the areas that I live in Durham, and I've got Amanda as a Director of Public Health in Durham, I'm often struck by the number of people who still smoke. More than 117,000 people have died prematurely from smoking in the North East since the year 2000. And as you are all very aware, it's our biggest preventable killer. And it's devastating for those thousands of people who have lost loved ones every year. And it also has significant implications for our health service, as well as that economic impact that it has on communities. And all the while, you all know this as well, the tobacco companies are making record profits, leaving the taxpayer and their families to pick up the pieces. And we all know that this deadly addiction locks people into a cycle of poverty, one which is really difficult to break without support. And we know that the regions with the highest levels of poverty in turn have the highest rates of smoking in England. And that smoking is one of the biggest drivers of health inequalities in constituencies up and down the country. So since being in Parliament in 2021, I tabled amendments to the Health and Social Care Bill to tackle smoking and youth vaping. And this included the levy on the tobacco companies' profits to fund the Stop Smoking services, and also inserts in the packs, the cigarette packs, containing health information with the links to smoking cessation services. And also the other amendments were around the ban on the tactics such as the branding and the sweet flavourings on the vapes to market the vapes to children. So they were all tabled and discussed, but to my amazement, not only did the government fail to adopt any of those amendments, they actually voted them down. And you know, these were all common sense proposals with a lot of evidence base around them, and ones which actually enjoyed cross-party support and had a lot of backing from health campaigners. And if those amendments had been passed, then these would have been the law today, but instead the government chose inaction. And you know, we know we cannot afford to waste any more time on this. Public health must come before petty party politics. And smoking is, we know it harms communities everywhere, regardless of which party you support. Smoking doesn't care who you vote for, and that's been demonstrated by the work on the All-Party Parliamentary Group. Its MPs come from across the House who have been long calling for action in this area. And for those of you who don't know what the All-Party Parliamentary Groups are, or what they're known as the APPGs, the cross-party groups organised by MPs and Lords who come together to discuss and address in a variety of policy areas. And the Smoking and Health APPG was established long before my time in Westminster. It was actually 1976 when that group was formed. But it still continues to play a really important role. It actually, we can propose debates in Parliament and publish inquiries and reports. And the work that comes from the parliamentary groups does provide real concrete evidence based on recommendations from the experts to the ministers. And so in 2021, this group, the APPG, published its recommendations for the Tobacco Control Plan and the measures that were needed to secure a smoke-free 2030. And these plans called for further regulations, such as increasing funding levied from the tobacco industry on a polluter pay principle, and investment in the communities where smoking has the biggest impact. And while the government measures that were recently announced were a step in the right direction, they really did fall short of that comprehensive strategy that's outlined both by the APPG and the Dr. Javed Khan's independent review into smoke-free 2030 policies. But cross-party and backbench support remains vital as we continue to press for bolder government action. We know that a strong cross-party consensus for legislative measures can make all the difference. And after all, we've seen that before. When the Labour government banned smoking in enclosed public spaces in 2007, that was a measure that would seem to many inconceivable. But today, more than 3/4 of the public support government action to reduce smoking, which means as MPs we have a duty and a responsibility to stand up on this issue. And as health inequalities worsen and lives really do remain at risk, we must all work together to end smoking for good. So thank you. Thank you for having me.